We want to get some more insight on all of this for parents watching right now. And for that, we turn to ABC News medical contributor Dr. Alok Patel of Stanford Children's Health. Doctor, thanks for taking the time.
Bill, thank you. And in addition to being a medical contributor, I'm a parent who knows exactly what people are going through.
All right, so let's get right into it. The CDC has now greenlit boosters for children 5 to 11. But as you know, fewer than 1/3 of children in that range have actually taken the first 2 shots to begin with. Many parents say they hesitated because it's believed kids have a lower risk of severe sickness than adults. That's what we were told. Has that equation changed at all?
Phil, it hasn't changed that kids are less likely to get severe illness, but we do know that children still can. They still can get hospitalized, pass it on to someone else, develop long COVID, and the odds are actually increasing now that we're getting more spread across all age groups, including over 90,000 kids testing positive last week. And I'm glad you brought up the fact that only 30% in this age group has been vaccinated, because as we talk about boosters, we still need to keep that front and center goal in mind. I hope this conversation about boosters and the fact that the CDC's independent review committee gave it the green light gives parents even more confidence, not only in the booster, but in the first 2 shots.
Yeah, maybe some will go back and get the first 2 shots and then continue on, would be the hope. So when those booster doses do become available, what's your advice for parents? What's the timeline for when they should actually consider getting those extra shots for their kids?
Well, as of now, parents want to wait 5 months after getting the second shot. And if there's any questions about a previous Omicron infection in your child, what your community transmission looks like, or the specific timing in your own individual case, questions we're already getting asked, parents should chat with their healthcare professional, because certain situations may change what your doctor recommends. But I think this news is welcome news, Phil, especially to those parents with children who have underlying medical conditions, kids who have immunocompromised conditions as well. So even though I don't think the parents are going to rush out in large quantities and get this booster shot, the ones who absolutely need it, the ones who are high risk, will, and that's important.
Let's talk a little bit more about that. The CDC recently estimated that 2 out of 3 children have already had COVID. So do those kids need boosters now? This is sort of another one of those timing issues. Or do they have natural antibodies that protect them? And if they do, for how long?
There's no doubt that kids who have had infections in the past have some form of natural immunity. But the reality is it's hard to tell when they had the infection, how long that natural immunity lasts, and if it's actually durable against these new variants. Because what studies have shown is that a previous infection to an earlier strain of Omicron may not be holding up against B.1.2.1. This is even the case with vaccine-acquired immunity. We know that after a certain amount of time, that immunity goes down as well. The first 2 shots in this age group, even though it's still protective against hospitalizations, it's not as protective against mild or even those moderate symptoms, which we don't want any kids to get sick. We don't want kids passing it on to someone else, missing school or anything like that.
We're still waiting on authorization for the first vaccine doses for children under 5 years old. So do you know anything more about the timeline of that? And is there any concern that we could see even more hesitancy from parents on vaccines for kids in the younger age group?
Well, Phil, to address your latter point, I do think that there is going to be some hesitancy from parents among this younger age group. We know that as the age group gets younger, parents are more and more protective, as they should be, which is why I think it's so important that we're transparent about the vetting process. People saw the FDA give an approval for this vaccine, the booster shot in kids 5 to 11, but parents forget that the Advisory Committee of Immunization Practices with the CDC are experts in this area. And as many of them have said, they wouldn't approve any vaccine unless they would give it to their own children. I hope that's the same dialogue that goes through in June when they discuss vaccines for younger children. Parents will also be wanting to look to see what things look like in the country with cases and with new variants. But I recommend all parents out there ask questions, go to evidence-based sources, and stay curious. We're all on the same page when it comes to defending our youngest.
And Doctor, you follow the numbers closely. We're seeing cases and hospitalizations on the rise yet again. Talk about the return of masking indoors. And I know there is COVID fatigue. How difficult is it going to be to implement after months of no mask mandates, especially when it comes to schools that have ended masking? Is it going to be too hard to get that done if we need to?
I don't think we can make any mistake about the fact that it is going to get difficult for people to revert back, which is why there was so much pushback when the CDC changed its metrics a few months ago. People saying, hey, if we have to go backwards now, we're going to run into a problem. And Phil, we're already seeing this right now with people saying that we're done with the restrictions and we don't want to live with it. But that inevitably pushes us into normalizing over 500 deaths a day and hundreds of thousands of positive tests each week in all age groups. It leaves us away from focusing on getting boosters in people above the age of 65 and getting all that layer protection into place. We just have to face reality that we still have a lot of infection out there. And even when we transition into an endemic, we still could have a lot of deaths. Endemic diseases are still deadly. Just look at malaria. We have to face this as we move into fall, and we do everything we can to make sure that things stay open, schools stay open, and people are able to live with some type of normalcy.
Amen to that. Dr. Alok Patel, thank you so much for your expertise, as always.
Bill, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.